Hi, everybody. Today I'm here to answer the question, how do I talk to a loved one about hospice or end-of-life care? I'm Pamela D. Wilson. My website is PamelaDWilson.com. On my website, helpful information for caregivers and aging adults about caregiving, health, well-being, so many helpful topics. A caregiver recently asked, my loved one is in a situation where they are probably near end of life, and my spouse, my parents, they won't talk about hospice care. How do I bridge this conversation? How do I initiate this conversation? The reality is, in life, death is an uncomfortable subject for everyone. It's uncomfortable for the people who are standing by watching a loved one experience health issues. It could be an uncomfortable subject for the person who has a life-threatening disease, who knows that their situation isn't getting better, and they don't know what to say. We're not taught to talk about death or end of life in life. It's a difficult subject. So how do we bring it up? Many times people who are nearing end of life have a degree of discomfort. They may be in great pain. They may have more bad days than good days. A conversation opener could be, it seems like you're in a lot of pain. It seems like you have more days when you don't want to get out of bed, when you don't feel good. I feel bad that I can't do anything for you. What can we do to have you be more comfortable? Many times a conversation about comfort can eventually lead to hospice, but it doesn't have to begin there. There are services that are called palliative care that are pretty relatively unknown, and I would use this service for many of my clients who were even in situations where they had a lot of pain and they were nowhere near death, nowhere near dying. Palliative care can be a much more comfortable conversation about how do we manage pain. If somebody has horrible arthritis pain or back pain, can we get a referral from a doctor for a palliative care referral and talk to a company who offers palliative care? Many companies who offer palliative care also offer hospice care, which makes the transition from palliative care to hospice care much more comfortable when that discussion has to take place, when it's time. So let's talk a little bit about that transition. Let's say that your loved one is on palliative care, they've been on it for a while, and the situation progresses. How do we have those conversations? In this video post, there is a link to an article on my website about a term called a prognosis, which is a conversation that you can have with a doctor to say, what does my health look like? Or what does the health of mom or dad or husband or wife look like 6 months from now? Is it going to get better? Should we start having conversations about, what if I'm in more pain? What if my health gets worse? Do I want extended treatment? Do I want to continually go to a hospital and then to a nursing home and back home? What does that conversation look like? If you joined me for my radio show this week, I had a special guest that had this conversation that talked about these things, about transitions between hospitals and nursing homes and back and forth. That interview is available, will be available in about a week on my website. So hospice care, what is it? It's end-of-life care. It's usually care during the last 6 months of life. And you wonder, well, how does anybody know? Honestly, sometimes they don't. Sometimes people who go on hospice graduate off hospice because they actually improve. But the H word, it's a scary conversation that we're all afraid to have because we think, if I do this, it's final. Know that it's not final. At any point, you can cancel hospice services. Sometimes, and I've done this, I've picked the wrong hospice for a client. They had different policies and procedures than what my client wants. Hospice care doesn't always mean that a person isn't treated for a medical condition, if that medical condition doesn't relate to their end of life issue. I had clients who would have urinary tract infections and they were on hospice. We would treat that because that wasn't the condition that got them admitted to hospice. Hospice can be provided in the home, it can be provided in a nursing home, and sometimes if hospice can't be managed at home, if all of the pain of a condition can't be managed in the home, in the last several days of life, a person can actually go to an inpatient hospice community. I know I'm offering a lot of information. It's a complicated subject. There is more information on my website. You can also join my caregiving group. It's called the Caregiving Trap on Facebook. My Facebook page is pameladwilson.page. We talk about this and many other subjects in my groups. I'm Pamela D. Wilson. Please share my website, pameladwilson.com, with other caregivers. So much helpful information there. Programs, classes, videos, podcasts, articles. It's all there. I thank you for joining me, and I will see you again soon in another video.